Good evening, everybody. You're very welcome to this, the 8th in our series of Let's Talk Equine. And I am delighted to be joined this evening by both Dr. Ursula Fogarty of the Irish Equine Centre and Nikki Walshe from UCD. Ursula, you can turn your camera back on there. Brilliant. Hello, ladies, and thank you very much for joining me this evening.
Hi, Wendy. How's it going?
Hi. So we're just checking that we can hear each other well. So I would like to welcome everybody who has taken the time to join us here today. And I just want to reaffirm that this webinar is being recorded and the recording will be made available on www.teagasc.ie. You are very, very, very welcome to submit your questions whilst we are online. We would love to hear from you, those of you who are joining with us, and submit your questions using the Q&A button that you will find at the bottom of your screens. So Ursula and Nikki, thank you, like I say, for taking the time to be with us. As we want to manage time this evening, we are going to kick straight into affairs. And I know that Ursula has put some time into preparing a presentation for us here this evening to set the scene and start us off. So I'm going to do a share screen here and hoping that that all works okay for us. Ursula, can you see the screen there now?
I can indeed.
So welcome and thank you for joining us, Ursula.
Okay, Nikki, they have me under starters orders here. There are a lot of slides. I'm not going to go through all in detail. Maybe just pick out some of the important points from each slide. And as Wendy has said, these will be available to view afterwards. So I presume everybody would like to come here, go away this evening and say, you do this on the first day of the month and you do that on the last day of the month and everything with parasites is sorted. Unfortunately not. Parasites, they're very adaptable. They play the numbers game very well. They have been around for thousands of years. They're always monitoring and changing much quicker than we do. And we're always playing catch up in terms of relevant information. With COVID-19, we're all being told that science has all the answers. Science is certainly a help, but we all know that science can change. A few years ago, fat was very bad. Now it's not so bad, and sugar is the problem. So dealing with nature, it's not for the control freak. And every day you're making probability decisions in an area of uncertainty, and under those circumstances, there'll be mistakes. As Henry Marsh, neurosurgeon, has often said. As humans, we tend to focus on the one fix-all factor. Next, there. We tend to go from boom to bust in terms of managing and dealing with parasites. Before there were anthelmintics, people were obsessed with stocking densities, pasture management, collecting feces. Then anthelmintics came along, and of course, as usual, we had a new anthelmintic. That was the answer to everything. Give it a few years, and then it's no longer. Parasites become a problem again. And we forget about all the other control measures, and we really haven't changed much over 100 years. So if we go on to the next slide, we just have a look here. I just listed out all the parasites that horses can get. Now, the large and small Strongyle, these are your red worms, you know, the large and small red worms. The ascarids are your roundworms. Tapeworms, obviously, people are familiar with. Strongyloides is one that's become a problem in recent years, especially in young foals. Eimeria is a bit like your coccidial parasite. Again, not supposed to be a problem, but if you have enough of them, they certainly are. Fluke can affect horses. It's not like in sheep and cattle, where you get acute fluke. It's a chronic disease. Oxyurus equi is the pinworm, which certainly is making a resurgence. And this is the one that the female lays the eggs under the tail and causes the horse to scratch its tail, which, you know, you may not be thinking of parasites in that regard, but we've certainly seen them through the PM room in recent years. Lungworm got such bad press with the donkey that poor lungworm has nearly been obliterated. You don't necessarily have to have exposure to the donkey to have lungworm. Some horses can develop, the lungworm can develop to maturity and produce eggs and larvae in the horse. The next one. This is just to give you an idea of, what happens. Like people say, oh, the horse is wormed, we give him an anthelmintic, everything is fine now. And I don't think people have an appreciation of what actually happens. If you look at the top left-hand corner, this is an aorta of a horse open. This is not taken from a photograph. This is actually a case that was submitted for post-mortem examination. The aorta, as you can imagine, should be nice and white and shiny and glistening. The red part is a conglomerate of fibrin and larvae. And these are in the circulation in the aorta, and as such can be distributed to the intestines, to the kidneys, to the uterus, to the hind legs, to the brain. So you can imagine if one of these gets lodged in a small vessel, the damage it can do. And we've even seen ruptured kidneys due to larvae getting trapped in the renal vessels. People say, oh yeah, I've dosed the horse, everything is fine, now we move on. But people forget that, there is residual damage left. And on the top right-hand corner, this is an artery that has been damaged by migrating large redworms. So you can see all those purple mineralized plaques that are there. And it doesn't take a genius to say that that vessel is not going to work as well as it did. Bottom left, you can see all these. This is an illuminated version of the colon of a horse. All those little black specks are actually very, very immature larvae. And when the larvae mature, they actually develop from a dot into 1 centimeter length. So you can imagine the amount of damage that that's going to do. And these can reach concentrations of maybe 30 to 50 per square centimeter. Now you'll see that while some of them are developed and emerging from the gut wall, there are still plenty left here. And this is the problem with the small strongyle, is that you can get an infestation in there. They can be in there for years. People say, well, we have moxidectin now, that kills everything. No wormer kills everything. People often said is that because they're surrounded by a thick fibrous capsule, they're not. It's just that they're metabolically inactive, so they're not taking up anything. So these can be emerging over even years. So if you get a bad infestation, they could be coming out for years. If you say treat with, say, the likes of moxidectin, that is quite effective against, the immatures. It's only at best still 60 to 70%. So if you're dealing with 300 worms, you have a 70% kill. You're not left with too many. If you start off with 3,000 or 300,000, well, you can imagine you're still going to be left with quite a lot. The next slide shows you, again, this is a real foal from the Irish Equine Centre post-mortem room. These, I actually hate to see the look. I hate them. They're like very thick spaghetti. They can reach certainly 36 centimetres, even up to 50 centimetres in length. They form a conglomerate in the small intestine. They cause obstruction. And you can even get rupture at the site of the obstruction. The next one, these are tapeworms, and they attach where the small intestine goes into the large intestine, there at the cecum. Now people say, they're very obvious, and if you open a horse post-mortem, they're terribly obvious. You can see them, everybody can see them, and we have tapeworms. And certainly they cause a problem, and if there are enough of them, they'll cause a blockage at that site. And you have a 3.5 greater likelihood of having a colic at that site with tapeworms. But I've never yet had tapeworms that I haven't found evidence of either large or small strongyles in conjunction. We go on to the next slide. This is a cross-section of the small intestine of a foal. All these structures that look, dark blue, they're all cross sections of worms, the Strongyloides. They're very small. They affect the young foal. They have a tremendous ability to reproduce because they have a very short window in which to do so. Now, people often talk about 100 or 200 or 500 eggs per gram. These worms are capable of producing up to 500,000 embryonated, eggs with larvae per gram of feces. And, so they are often a cause of diarrhea. They're often forgotten about. People maybe might think of bacteria or viruses, but these are often maybe underlying. They can allegedly penetrate the skin of the foal. They can be transferred apparently in colostrum. And they can even reproduce on the ground. So they don't have to go into the animal to reproduce. If you have warm, moist conditions on the field or in a stable, they can actually reproduce there and reach incredible numbers. Now, the next slide shows you these are adult fluke, like that's the size, and you consider that these are migrating around in your bile ducts. They don't cause, as I say, the acute disease as they do in sheep and cattle, but they certainly can cause a chronic disease. You obviously need the appropriate conditions for them. This is a hydatid cyst, which often looks like a collection of eggs in the liver. It's the intermediate stage of the tapeworm of a dog. So the next slide then, fecal egg counts. There's a lot to talk about fecal egg counts. Are they useful, are they not? They certainly are, but you need to know, what the information is telling you. It is technique dependent. When you're looking for eggs, you're floating them in a salt solution. Now, because these Strongyle eggs are very light, they'll float easy enough. If you're looking for fluke eggs, you need something thicker to float them. Aspirid eggs, are very characteristic. If we just look at here, the type of worm, when you have a Strongyle egg, it doesn't tell you whether it's large or small. You'd have to do a lot more work, which isn't usually feasible to do that. Professor Soulsby, who wrote the book basically on helminthology, was much more focused on using fecal egg counts for detection of the presence of parasites versus getting obsessed with numbers. Because if you take immature worms, it takes them a while to become adult and then to lay eggs. If you're talking about the large Strongyles, it could take between 6 and 12 months. So you could have a negative fecal egg count for 6 to 12 months and yet have quite a severe infestation. If you're talking about Strongyloides, of course, they reproduce so quickly that you're always likely, if they're there, to pick them up on a fecal egg count. We assume that if you take a fecal sample, that everything is going to be the same. It's going to vary from one day to the next. It's going to vary from one fecal pellet to the next. There's been a lot of focus on the high shedder. So the high shedder are ones that produce a lot of eggs. So people focus on them, that they produce, most of the eggs. But you have a small percentage which have the highest fecal egg count. But if you have a lot of horses with a small number of eggs, they're going to actually contaminate a pasture every bit as much as this high shedder. So, you need to kind of keep a broad focus always in mind. Now, this is just like, obviously this is very high stocking density, but it's just interesting that if you have this kind of fecal deposition, which thoroughbreds tend to do, the feces are going to be widely distributed over the pastures. Ponies, for instance, often have toilet areas or dung areas, so it's much easier, and they avoid them. And it's much easier, to collect feces or parasite control this type of deposition. But they don't always do that. And why they do this and do that, I don't know. But I often thought it's an interesting point. It never ceases to amaze me in this era. Everybody is obsessed with evidence-based medicine, and your experience, of course, was poo-pooed and, not really that, it was much more fashionable to be talking about evidence-based medicine. But the medics who brought in this concept have now moved on to interpersonal medicine, where you take every factor into consideration. So you take the experience, you take the evidence, and you try and amass as good a handle on a situation as you can. Now, this thing that you don't have to dose an animal unless they have more than 200 or certainly 500 strong, it never ceases to amaze me how this caught on. Whereas this was based on no evidence. This was just considered a good idea because you weren't using enough as much anthelmintic. Great idea. But the thing is, if you say a horse produces 20 to 30 kg of feces a day, that's 4 million eggs per 200 kg. So if you have 10 horses going around producing 200 Strongyle eggs, you won't be long contaminating the pasture, even though you're totally focused on the horse that's producing 1,000 Strongyle eggs per day. So at the Equine Centre a number of years ago, I'd always have a look at what the parasite burden was like in PMs that came in for whatever reason. People were always very interested in feedback on their worming status. So then I started to say to myself, well, I see worms here. I wonder what the fecal egg count is like. And that developed into taking a fecal egg sample from every PM that came in. So if we go to the next slide, so Strongyle eggs and parasites are certainly the most prevalent. And, you will pick up quite you will detect the infestation by fecal egg count. Strongyles, because they produce so many eggs and they have such a short pre-patent period, if they're there, you're very unlucky not to pick them up with the fecal egg count. Tapeworms, ascards and fluke are the most likely to be underestimated by a fecal egg count. So if we go then and look, in 2012, of course, we were emerging out of recession and the horse numbers went up. We had this concept that you didn't need to dose something unless they had more than 200. So, I gradually began to notice, that the number of horses with a negative fecal egg count was actually coming down quite significantly. Here we began to get very worried because the effect of this was beginning to manifest, if you go to the next slide, in an increase in the incidence of serious disease due to parasites. It wasn't that you were just detecting them, animals were dying because of parasites. In 2016, say if we, it's only 6 animals, but it's the tip of the iceberg. These are ones that had something like the aorta that I showed you, something like ruptured kidneys, like really severe evidence of large Strongyle infestation. And of course, the incidence of sciatostomes, has gone up and is continuing to increase because they're much more difficult to manage. These are quite susceptible to anthelmintics, and fortunately yet, there's not too much evidence of resistance. Now, the parasitology community have always said that, because they're so susceptible that they were virtually extinct. Now, in Ireland, I can certainly assure you that they have never been extinct, and they're becoming much more prevalent on a worldwide basis as well. So, as I say, the sciatostomes are much more difficult. There's much more evidence of resistance, and then you have this inhibited larvae, which are very difficult to deal with. So if we go to the next slide, over the same period, the incidence of Strongyloides and parasitism also increased. And if we go to the next slide, the level of tapeworm infestation also increased. So if we go to the next slide then, at the moment we're seeing a decrease in the number of horses with a positive fecal egg count, which is good. So there'll be, hopefully less pasture contamination. There's still quite a lot of, pasture contamination around. So we're still seeing problems with, immature larvae. Everybody jumps on the bandwagon that anthelmintics are less effective, and they certainly are. You will have increasing resistance. You'll have less of a reduction in your fecal egg count after treatment, and the egg reappearance time will be shorter, because when you dose, depending on the dose you use, the eggs will be, if you're using the benzimidazoles, the adults will be back laying. You'll have adults again in about a month. With moxidectin, it was that we wouldn't have any adults laying eggs for about 4 months. But you still have to come back then to the percentage kill, that none of these parasites or anthelmintics are 100% effective. So it does depend on the level of infestation that you're starting out with, how many you're still left with, which is, nothing to do with resistance. Like, it is a manifestation of the initial worm burden that you have there. So this is what often happens, is people say that I've dosed, and then I go back and see what my fecal egg count is like, and the next thing is there are eggs still there. That's because you've got rid of, some of the adults and the more mature larvae, and then this is given the immatures a signal to develop, and then they're maturing into adults, and this is often presumed to be resistance. Now it may be, but it's not. The fecal egg count is very useful, because it gives you an idea of how many horses are, have infestation, and it also gives you an idea of what level of pasture contamination is going on. And these worms, like the ascarids, the cyathostones, the large strongyles, these actually, apart from causing ill thrift, can, when they're severe enough, cause mortality. So we come back, as always, we've all become experts now in disease monitoring, and we're used to hearing all these terms with COVID-19, but with any disease, with any parasite, the cornerstones of control are always your stocking density, movement, your metabolism, and your nutrition. And then, of course, if you have worms, they cost money. They cause ill thrift, maybe poor performance, even death. So they do cost to control them. It's not just a monetary cost in terms of buying anthelmintics, but in terms of, pasture management, and all the other measures that you need to do to control, your parasitic problems. So that's that.
Thank you very much, Ursula. That's the whirlwind tour of parasitology and the things that you come up against on the post-mortem table in the Irish Equine Centre, which is the sad part of the story as well too, the relatedness to mortality issues at the end of the day. Just, I suppose, look, we know that there's increasing instance of certain parasites, the small red worm, the roundworm, the tapeworm. We see the re-emergence of issues with pinworms, as you said. There is, that growing resistance problem that we have with the chemical groups that are available, and, we need to manage that. And I suppose, in the background to all this, there are inconsistencies across the board in terms of the advice that is, out there and circulating and from different sources. And, I think for the most part, I think that people on the ground, the horse keepers, they do try as far as they can to do the right thing, but sometimes it can be difficult to figure out what the right thing is, and in order to, do the best that they can. Nikki, if I come across to you, I mean, we do often use the term like prevention is the first line of defense. Do you agree with that in terms of this particular situation?
I suppose Ursula touched on it there, and I think you make a valid point, Wendy, that majority of horse stockmen and women who are doing their very best. But I suppose one has to remember that, contamination of pastures is going to be your infectious dose. So, you can actually physically see infectious doses in a way. So if you look at one of that field that Ursula would have shown, there was a very high fecal contamination. So you already can tell, even if, like we said, that they could be low shedders, i.e. low shedders defined as under 200 eggs per gram, with that amount of fecal contamination, then you're going to ensure that that horses on that pasture get a high infectious dose. And so I suppose when we talk about our approach to anthelmintic treatment, what we really should be talking about is our approach to parasite control. And our approach to parasite control is based on risk. So understanding just the elements of risk, I suppose, Wendy, would be the most important things. And so that is around your infectious dose, as discussed. So usually pasture contamination and the level of eggs being shed on the pasture. Also the conditions in which they're being shed. As Ursula would have mentioned about Strongyloides westeri, they can produce and reproduce themselves in good weather, but also worms need good weather. And we've got the perfect weather here. And when I say good weather, I mean moist, mild weather, which is basically us all year round, unfortunately. And that leads to your contamination. But then you have to talk or think about immunity as well, you know, because just like we've talked, and Ursula brought up a few times about COVID, you know, we talk a lot about different immunity types and people having lower or immunity than others. It's the exact same with parasites. So your younger and older horses, or horses who are compromised because of stress, concurrent disease, etc. And then the final thing, I suppose, is effective treatment or detection, which is what you were speaking to as well, in and around, you know, anthelmintic treatment, etc. But also detection around our diagnostics and how we use them. As Ursula was saying, fecal egg counts and the 200 eggs per gram became very, very popular. That was it was a paper that was released in 2003, actually, where it was a collection of data that was put together and opinions that were put together. But even within that paper, it was said that this was just to help people to look at contamination, not necessarily the individual horse infection dose, if that makes sense.
So kind of if we take that then to the, I suppose, you know, I mean, the pasture management, the stable hygiene, all that side of it is also crucially important in terms of managing our horses and preventing, as far as we can, the issues arising.
Yes.
You know, the conversation around fecal egg counts, I find this is one that, you know, sometimes there is, I suppose, a degree of how often do we need to do they need to be done, the frequency around them, you know, why they're being done in the first place. And I suppose, you know, using them not only as kind of the, you know, to tell us the story as to what's there. It's not as simple and clear cut as that always. You know, using them also in the conversation around, as you mentioned, Ursula, the fecal egg count reduction tests and, you know, the egg reappearance times and so forth like that as well. If I go back to Ursula, maybe to start with, you know, why is it so important that the fecal egg count remains as part of the management program?
And because it gives you a good idea. It's a monitor. It's probably the easiest monitor that you can use to determine, you know, what level of infestation is in the horses, how many are affected, you know, given all the scenarios, you know, that you might have a negative count. And it also gives you an idea of what sort of pasture contamination, you know, that you are creating.
And you've emphasized before how the samples are taken is so important as well.
It is, yeah. It is important actually to take maybe a few fecal balls and to mix them and then subsample that. Mm-hmm. Because when you think of like the amount we're taking in the lab is very small. Mm-hmm. You know, so if you have a good mixed sample, you know, you're obviously going to get a much better. And the more horses you sample, you know, the better.
Mm-hmm, mm-hmm.
Yeah.
And Nikki, like, I mean, you're out there in clinical practice as well, and you know, what's your recommendation in terms of the frequency with which the fecal egg counts need to be taken, and does that differ between different age categories of stock and you know, different, I suppose, levels of risk in that as well?
Yeah, it's actually a question that came up in the Q&A there. So yeah, it's very much determined by what you're trying to achieve as well. You know, the thing about fecal egg counts is you have to know their limitations and applications, I suppose. And Ursula has already touched on a good few of them. And so even boiling it down to what exactly you're talking about. So a fecal egg count, the eggs that you're speaking of are produced by female adults of 2 different types of parasites only, usually, okay? You can do more in-depth tests, which Ursula spoke about, to maybe look for tapeworm eggs, etc. And you can get lucky in the form in younger horses that you might see ascarid eggs, but if you don't, it doesn't mean they're not there. And as Ursula was saying, Strongylus westeri are so prolific, you can use those quite effectively as monitoring tools for Strongylus westeri. So, you know, when you talk about that it only covers adult female Strongyles on the majority of cases, you can see how much of the worm you're missing out. So those beautiful pictures that were, well, maybe not beautiful for some, but beautiful pictures of the postmortems of the Sciatostomen, they're all immature stages, so they've no ability to produce eggs. So your egg count won't reflect them. So how we like to apply it, I actually have a wee slide in it. Will I throw it up?
Yeah, do, yeah.
How we like to try our best to apply it is basically, so basically it should be around looking at anthelmintic efficacy. Okay, so that's what you commented on there, Wendy, in and around the fact that we look at the reduction test. Okay, so just to give you the specifics around that, you're talking about taking a fecal egg count, and if you get a positive, when you treat, you then take another one 10 to 14 days later. Because, you know, if you ask someone, you know, would you give a treatment if you know it didn't work? You'd say, no, of course I wouldn't give a treatment if I knew it didn't work. And the best way to find out whether it works on your farm is to do an egg count, give your treatment, and then see have the eggs of the adults gone away. Now we know, as Ursula was saying, and such a valid point, loads of the stages of parasites are not affected by certain different anthelmintics, and there is no golden bullet. You'll never give a wormer to a horse. I don't care how you give it, what you give, you'll never give a wormer to a horse who'll get rid of all of the worms. It just doesn't work like that. So at least this way you could say, right, well, I know it's been effective against the stages that it's meant to be effective against, if that makes sense. So if you were on a farm that's particularly, you're a bit worried about anthelmintic use and you're a bit worried about resistance, and maybe you have a kind of high risk farm, I would nearly check each of my wormers. So if I'm rotating my wormers, you know, targeting different parasites at different times a year, I would check them with your fecal egg reduction test. The other thing, Jane Hodgkinson talks about, Ursula, I don't know if you remember that from the ITBA talk, talks about this like levels of infection. So Ursula talked about high shedders and so on. I agree that you don't just focus on high shedders, but sometimes it's nice to see how your herd lines up. Your herd should, in and around, and this is all, you know, subject to change, but in and around your herd should be kind of 80-20. So 20 of your horses should be relatively higher shedders than the rest. If it's starting to go 50-50 or 60-40 to the wrong way, you know, then you have a much higher infectious burden, and the normal immunity of these horses who normally don't have high counts is being affected because the burden that they're taking on is just that bit too much. Identifying high shedders just purely around contamination, but as Ursula said, if you have enough horses with low shedding, you're going to have a high contamination anyway. And then, like we said, monitoring young stock. And the last thing, I suppose, is they talk about it, you know, in regards to disease, clinical disease, development of clinical disease. And you definitely can use it in those scenarios. I suppose we just have to be very careful that even if you got a negative fecal egg count, because a lot of the disease is caused by immature stages, you'd have to be careful that you don't think they don't have worms just because it's negative. So they'd be the main areas I would use it in. But in regards to your average horse, you know, if you have an average horse who's low risk, if you're taking a fecal egg count twice a year, I think you're doing really, really well. But if you're in a stud farm where you have young stock, high intensity, you should be using it as a monitoring tool like Ursula was speaking of. So that's much more regular. So unfortunately,
the stocking rate is so important, isn't it?
So important. And I appreciate the question, and I wish I could give you a black and white answer. But it really is in tandem with your vet working out what kind of risk you're dealing with and trying to figure out what would be the most effective ways of looking at that.
And Ursula, if I come back across to yourself, I mean, you know, fecal egg counts, they're one of the diagnostic tools that are available. There are others there as well. You know, maybe talk to us a little bit about that and where you sit with those as well.
Yeah. Like people will often take a blood sample, you know, you may or may not have an elevation in urea eosinophil count. your globulin fraction of your proteins will go up, specifically the beta-2 globulins. And if there's if there's the possibility, there are other blood tests that you can carry out that detect, say, tapeworm antigen. There's also another one that gives you a likelihood of having, certain levels of cyatostome or small redworm infestation as well. So they're actually quite useful too. If you have a lot of ascarids, it is possible to see distended loops of bowel and see the ascarids in the bowel by ultrasound scanning.
Yeah, and I would second Ursula on a normal blood is really helpful. I haven't used the encysted cytostome one that much, but the tapeworm one, tapeworm blood test can be good, and again, more monitoring your herd level, probably. So yeah, there is other diagnostics out there, and again, another discussion to have, I suppose.
Yeah, the cyatostome test, we've been trying it, blood, say, serum collected post-mortem, where we see that it's a light or a heavy, and it is actually, it is useful. Yeah, because, that is a problem that you will have before you may have a positive fecal egg count. Because those worms tend to come out, in the springtime. The word gets around, that the conditions are good outside. They stay inside for the winter. It's too cold, to develop. So
I love the way you say the word gets around.
It does.
Well, it does. These worms are very smart,
Yeah.
They're incredibly smart. We are always playing catch up.
Yeah, and that's why, if you have one that you're worried about and you have a fecal egg count that's negative, but you're still worried about it, a blood can be a really good start and getting a little bit more on the diagnostics.
And, equally, what makes some of these worms, the small Strongyles particularly, what makes them, develop or come out? Like we don't really know, we don't understand all the factors. You can have maybe horses that are well wormed. There may still be larvae in there that you're not aware of. And the next thing is you stress the horse, maybe like a racehorse in training. After a run, the next thing is they'll have a positive fecal egg count.
Absolutely, there's so many factors going on. There's actually two questions in here, ladies, just reverting back to the pasture management side of things. In terms of mixed grazing and rotational grazing, and I suppose the benefits of mixed grazing and whether there's evidence base around that.
Yeah, they're actually, firstly, I suppose, a lot of the time, if you think about cattle or sheep, they are a dead end host for equine worms. So that can be quite nice because they'll consume the eggs off the ground in a way. And yeah, there is literature evidence, but there's also real life evidence that it is helpful. But as you would have seen with Ursula's presentation, horses can suffer from chronic liver fluke. And Ursula had mentioned that certain conditions lend themselves to that. And unfortunately, again, we kind of have this, and some people, again, will say that horses don't suffer from liver fluke, but if you talk to people west of the Shannon, they will certainly be able to confirm that they certainly do. So you just have to be quite careful of the stock that you use, that you're happy that they don't have a particularly high fluke burden and you don't have the conditions that might precipitate that. But I think co-grazing is very helpful, particularly from what I've seen and what the people I work with, sheep in particular, they seem to give a really clean pasture. So yes, I do think it's quite effective to either
graze tighter as well.
They do, yeah. Now, look, the problem is that it's not easy for everyone to do that. Sorry, I'm not a farmer myself, but from what I know, sheep can break out of anywhere, and trying to get good fencing and all that is quite difficult. But yeah, it is a good solution if you have a high intensity farm and you're finding it difficult to give your pastures as much time as you'd like. Cross grazing or co-grazing can be quite helpful. I don't know what you think of it, Ursula.
Yeah, no, I suppose, we have horses at home, and I'm always trying out these things, and it kind of keeps you grounded in that it's very easy to hand out recommendations, but to actually work through them. But the other thing about cattle is cattle will eat some of the grasses that the horses won't eat, which is great. So you don't end up with these, there's a grass benefit, you know, from co-grazing as well. They're not as hard to fence as sheep. The other, I suppose, thing is that, you know, a lot of people say, oh God, do I need to plough up the, you know, the field? Now, ploughing is probably the last thing you need to do with horses, especially if you're tight on the ground. Because if you plough up, first of all, you're using Roundup, which is going to tie up all your divalent cations and, you know, reduce your calcium and, you know, copper and whatever uptake. Then you're going to put in, you know, new grasses. It's going to take them about 3 to 5 years to settle down properly before you can put the horses back on them. So, like with your co-grazing, it's very good. But I think what is also very effective, which was always done before, is if you say if you've taken hay or hay off a field, it's you know, it's a very good way. Some people say, well, oh sure, look, some of the eggs are gone down into the surface layers of the soil. But if you're taking off hay, and if aspirate eggs can live in hay for anything from 1 to 5 years, well, the way I look at that is if they're in the hay, well, they're not on the ground, so you've taken them away. And the other thing is you don't have to wait to take a crop of hay or silage. Like once in the springtime, you know, when the, you know, the moisture, when the grass starts to grow, all you need is a little bit of growth. The worms will be hatching around the same time. And if you can remove that grass, now if you want to bale it or do whatever you like with it, you know, you're not wasting a lot of grass. But when in the springtime, when there's a lot of grass, it's a great way of cleaning up a field very quickly. I mean, you have, you know, a relatively clean, you bring down your level quite significantly in a matter of a few weeks.
They're all options that people have open to them.
Yeah.
Reverting just quickly now back to the fecal egg counts, there's just a question here. Is there a particular time of the year that's better to do the fecal egg count?
There's some indications about that. I find the jury's a little bit out on that because a lot of the research that we get around this, I mean, Ursula would have talked about this before, a lot of the research we get comes from Kentucky and some places in Sweden and Denmark and so on. Whereas I find we have very good conditions for parasites to do well here, even in wintertime. So even today I got in fecal accounts from 20 horses, and there was some horses still in the thousands at this time of year, which will be quite unusual. In other places they would have said, oh, they should be much lower, you know. And so ideally, the summertime is a good time because horses are out in pasture. They're not in stables and they're consuming larvae, and so you have a much better chance of getting a positive fecal egg count that you can use diagnostically. But again, it will depend how it fits into your plan. And I'm sorry to harp back to that, but unfortunately you have to factor it in rather than it being a set thing, from my point of view anyway.
There's another question that's just popped in here. If you have sheep on pasture which is grazed by horses, should you consider dosing the horses for fluke, where the area is known as being very suitable for fluke? Horses appear to be in good condition or look well.
Okay, do you want to go first in that, Ursula, or I can?
Well, I would say if you're bringing in the sheep, I'd say the thing is to dose the sheep, you know, first. You know, try and avoid, now if say, you know, with the history of the pasture, you know, that it has had cattle and sheep on it and it is suitable for fluke, you know, it is worth considering if you're not happy with their
condition or something.
Yeah, with their condition, yeah.
I suppose that the thing is it's off-label. You'd have to use a off-label fluke dosing, so tricobenzazole or something like that. The other option, if you were concerned, I've used it a bit. I don't know what you think of it, Ursula. There is a liver fluke blood test now available in Liverpool. And, you know, or if you wanted to, you could maybe take a blood and look at whether there has been damage to the liver through an increase in liver enzymes. Not the most reliable, but, you know, if you were concerned about a horse who was maybe under the weather or not looking great. So they'd be two options, you know, you could look at as well. I don't think I haven't seen much of it being picked up in fecal egg counts. I don't know, Ursula, have you had many positives on fecal egg counts?
Yeah, if people ask you, to specifically, now sometimes you'll be lucky in that the fluke eggs will float in the flotation medium.
Yes, yes.
But if people ask you specifically, to check for fluke eggs, it is worth checking a fecal egg count for them, or a fecal sample for fluke eggs. You will pick them up. It's worth looking. Yeah.
I want to talk a little bit about, the actual risk assessment and that side of the equation. Nikki, I know you had a nice slide on that. Do you want to maybe share that?
Sure, yeah, sure. I'll see if I can do it a bit better this time. So, yeah, so because someone just asked actually there, when and what do you give? I saw that. So I suppose that's what I was trying to speak of there, just a really simple diagram, but I present this to all my final year vets before they leave UCD, because it's understanding this that gives you the basis of most management practices. And as Ursula said, this is what we used to base all our parasite control programs on, and then we kind of moved away once we got these anthelmintics. So what I would first, I like to define a risk. So, the risk obviously is a horse developing endoparasite related disease. Okay, so it's not necessarily having parasites within them, because they are old friends. As Ursula said, they go back thousands of years. They're meant to have parasites. In fact, a lot of the work I'm doing on my PhD is about the mix of parasites and the gut flora and how it's all very intertwined. So what we're trying to do is just keep it at a balance that it doesn't develop into disease. And so then what we do is we look at the risk factors associated with that. So they would be the three things. You're talking about a high infectious dose, you're talking about a low level of immunity, and then a failure to detect that or treat that problem. And so when you're talking about a high infectious dose, these are the kind of risk factors associated with that. So high stocking density, horse tired field, even some of the really, really good studs, like these pristine, beautiful studs, because they've had so many decades of horses on them and maybe haven't implemented cross grazing or things like that, they can actually have issues with parasite burdens, no mixed grazing, as we spoke about there. High shedders in particular, obviously, are going to be more highly contaminated, but not the only ones. And then a decrease in food resources. Again, if you look at that field that Ursula had put up, you could see it was quite bare. So horses are going to, they're going to graze very close to fecal paths then, trying to get a bit of grass, And so then what we talk about then is trying to alleviate that risk by mitigating it. And these are all the things we've spoken about just there. And the effective anthelmintic treatment obviously would be in and around, using our fecal egg reduction tests, and obviously being careful about to deliver fluke if we are going to do cross grazing. When we talk about low levels of immunity, and that's why, sorry, I don't know what name was associated with that question, but in regards to what and when, it'll really depend on your horse and your conditions. So your conditions, the one, the slide above, but your horse will be like, horses under the age of 5, I would consider quite high risk, but foals in particular, of course, and horses under high stress. So, those horses who come into training are being broken in. And then your oldies, your golden oldies, especially if they have any signs of Cushing's, often will have much higher counts and be much more susceptible to disease. And of course, concurrent disease, just like us, if you have something else going on, like a cold or a flu, you're much more likely to get a secondary disease. And then again, mitigating, we're talking about good anthelmintic treatment at the right times, and recognizing or monitoring signs of stress so that you're looking for fecal egg counts, and then treating concurrent disease if you recognize it. And then finally, and this is really where we're talking about these monitoring things that Ursula was talking about, and we're looking for maybe the anthelmintic we're using isn't actually working as well as we'd like it to on the stages we'd like it to work on that parasite. Maybe we're not using any diagnostics, so we don't know what's working on farm, and we don't know what our herd level of infection is like. And then irregular and erratic deworming, because just like we were talking about, stressful events or upsetting the gut can actually worsen the situation. So, if a horse has quite high burden and then we just go in with a worm, or sometimes we can actually make the situation worse than better, And that's where this FECRT is just basically a reduction test that we were talking about. And actually record keeping, and this is something we would have talked about before, Wendy, that, having a look at when you give and what you give. And as Ursula was saying in that conversation, then you can start to see trends of what you're doing and what you're giving, and whether or not it's associated with any problems. So that's basically what you end up with then, is when you look at that, you end up with like a low, a moderate, and a high risk. I'm not going to go through all of that, and of course we can make this available to people, anyone who wants it, but that's then your starting point. And once you have that starting point, that's when you can go back then to your vet and start implementing your risk assessment and figuring out when you're going to do your fecal egg counts, when you're going to give your wormers, and what else you can do maybe to mitigate the risk.
So, given all of that, I'm watching the clock as well here too, and there's certain things that I want to kind of still tip off of before we finish up this evening. Like there are certain categories of stock that, maybe we can offer a little bit of advice around. You have the instance where you have new horses come into the yard, and I know there was a question there about how long it takes after you give a wormer for the wormers to be excreted, and that kind of relates into that. Maybe just one of you maybe take that as who would like to go with new horses into the yard.
Well,
Nikki, go first.
I spoke for loads there. I was going to give Ursula a go there.
Yeah, go first.
Yeah, so what we would talk about is, number one, bringing in your horse. I have a bit of a thing about just bringing in horses and dosing them straight away. I said it to yourself and Ursula, that, I'm very much into not disturbing the gut all at one time. So a lot of time you're changing the horse's environment, which is quite stressful, and often changing their feed, which of course in itself, we've all seen horses develop colic from that. So I tend to leave them settle for a couple of days if I can, and then advise to give quite a comprehensive treatment. The one that is labeled to be the most comprehensive would be your moxidectin and praziquantel. So that would be your Equest Pramox. I'm not saying it's the be all and end all. I'm not saying it's the golden bullet, but it is probably the most comprehensive license treatment that we have. So you're talking about your red worm, hopefully your large Strongyles, and then your tapeworm as well. And then I would keep the horse in for maybe up to 72 hours. So up to the 3 days. You probably get away with 2, but up to 3 days. And then the eggs that would have been left, the residual eggs would have been left behind in the feces in the stable, and you're removing them anyway, because it does take time for eggs to become larvae, to become the next part to be ingested. So eggs once they're removed aren't as big a problem.
I'm just watching some of the questions there as well as you're talking about that, because there's another one here that in relation to when you dose when horses are pastured, said how you reduce the risk of reinfestation. How long should pasture be left after deworming?
I'll leave that to Ursula. So
did you catch that, Ursula? How long would you rest pasture to kind of safely say that you're lowering the risk of reinfestation?
Well, a lot does depend on the weather conditions. If you're talking about, the summer, like say over the winter, people think, that the worm burden will be reduced. Like if you want it to be absolutely safe, you're talking about a year. Year and a half.
Yeah.
Now, if like it is actually quite a long time.
It's an impractical amount of time for a lot of people.
Yeah.
I'm going to kind of rush a little bit now, just try and fit a few things in. Foals, first time to worm foals, how often to worm foals, and worming in relation to weaning. Who would like to go with that topic? Nikki, you're bursting at the gates. Go first.
I can start with that. I think everyone will have a different perspective on this.
Yeah.
So, okay, so for me, firstly, because the first worm that they generally get is that Strongyloides westeri we were speaking of earlier. And that generally, so I like to monitor for that. So people mightn't really want to do that, but that would probably be my best starting point. So at maybe 2 weeks or a month, I'll take a fecal egg count. And as Ursula was saying, like you can get thousands of these, like into the thousands. And so, I would, if I had a very high count, and I would speak with my vet about it, I would probably dose according to that. If I didn't have a very high count, I'd be a little bit happier to continue without having given it. Because again, they're just developing their little gut. There's a lot of things they can get. And sometimes, they can get other diarrheas that might be associated with the worms or might not, because they will produce eggs anyway. So we have to be kind of careful on that. Then I will dose at 2 months. I'll dose for ascarids, and I recommend a 5-day course of 10 mg per kg. Now, I was called on this recently, and some people think they only need 1 dose, and I can't tell you that that's wrong. I just know that in clinical practice, I've been using 5 days dosing, and that's what I am confident in.
Of which product, Nikki?
Sorry, fenbendazole. So that's your 10 mg per kg for 5 days. That's at 2 months. Panicure. Sorry. Yes. Panicure. Sorry, Wendy. Yeah, no Panicure. And then I'll monitor those, and I might, depending on the risk, I might dose them again for ascarids at maybe 6 months. And so after that,
could you expand that in terms of the timing of weaning, relatedness there?
Yeah, I'd be very careful with worming after weaning. I would nearly prefer to worm them when they are nice and safe and with their mom and hanging out and very comfortable in their environment, and they're not stressed.
We talked about the stress factor, yeah.
Yeah, stress and change of environment. So if you're going to wean at 6 months, maybe a little bit before that. If you can push them out to 7 months, maybe do it at 6 months. And at that point, you can give maybe an ivermectin or a fenbendazole treatment. And at that point, I would be thinking, as Ursula said, about Strongyles vulgaris. I do also think it's still a problem. So that's where your ivermectin comes in. And maybe tapeworm at that point too. So maybe a praziquantel. I tend to stay away from moxidectin in foals until they're a good bit older, maybe 8-9 months. But I don't know, Ursula, if you'd agree with that. And so you're looking at probably dosing a foal between 3 to 4, maybe 5 in a very high intensity, very worried environment, from my point of view. But I would still track them with fecal egg count C. So I'd probably go off a lot of that as well. So that wasn't a very straightforward answer, but I hope it helped a bit. Okay.
Ursula, do you have anything different to say to that, or will we move to the pregnant mare and foaling and that conversation? Well, yeah, any added comments on the foals?
Yeah, it probably merges with the pregnant mare. Yeah, I'd agree with Nikki. You know, moxidectin is quite, you know, and it's not actually really recommended for foals under 6 months. If you're dosing the mare before foaling, I don't, even though I think it is recommended, or, you know, it's, but I don't think it's a good idea, because if you give moxidectin, you know, it is retained in the fat. I've no doubt that some of it is getting across in the milk. I don't think it's a good idea, you know, to be giving the pregnant mare moxidectin before foaling. Or maybe, you know, while she's suckling.
And have you positive advice in terms of dealing with the mare before foaling?
Yeah, well, I suppose before foaling, you know, people, you know, the two things you're probably worried about are maybe Strongyle, small, you know, the large, small red worm, and your Strongyloides. So I suppose, you know, it probably is safer to go with an ivermectin.
Okay. Yeah. I think I'm going to give us another little couple of minutes just to finish a few things out, because I kind of feel like it would be just ending the conversation too soon at the moment, if that's okay with you ladies.
Oh yeah, that's fine.
Yeah, because this is it's a topic that's not easy to rush through either, you know. There's I think a very good questions come in here in relation to resistance to anthelmintics. Is there a particular pattern of resistance developing in Ireland? If so, does it differ in different regions? And would there be a pattern of resistance occurring in equines that may be following a similar pattern to bovines or ovines? There's a couple of questions in that, even if we take the first bits of it in relation to the resistance situation as you guys see it here in Ireland.
I think firstly, it's not necessarily resistance as much as it's decreased in the length of time between treatment and when we're seeing eggs reappear. So we have to be very careful how we go about that one. Certainly. And the other problem is that even though I'm trying my best, there isn't a whole heap of research done in Ireland, that this is the biggest problem. So if you ever have someone knocking on your door who wants to do research in Ireland, please say yes, because I'd love to get more Irish related information for you. So unfortunately, a lot of the information I'm going to be able to relate to you will be, when Ursula just said, evidence-wise, will probably be from elsewhere, and then personally wise, I'll be able to tell you my own experience. So evidence wise, we're starting to see resistance in ascarids, which is quite worrisome. You would have seen that really cool picture that Ursula had of the spaghetti worm. I also call it a spaghetti worm. So there's a lot of resistance to ivermectin and moxidectin, and so sometimes you'll see problems in foals who are purely dosed with ivermectin through their early years, and that's why I would have recommended the fenbendazole. We have to be quite careful though, because on the other hand, fenbendazole, there has been some evidence of resistance to fenbendazole in some of our large and small Strongyle. So they'd be the more common picture. But again, the way to figure that out is if you do your egg reduction test on your own farm, because just because it's in Kentucky or just because it's in England doesn't mean necessarily it's here. Anecdotally, I have seen fenbendazole resistance on a couple of farms, even where people will do a fecal egg count beforehand, they'll give fenbendazole or panicure, Wendy, and egg counts will go up 2 weeks later. So I have seen that. And anecdotally, again, on the west of the Shannon, but I'm biased because that's where I did a lot of my work, they thought there might be some resistance to ivermectin. They felt maybe it wasn't working as well in their animals as it had done before. So in answer to your question, I don't know if it's following the pattern of bovine ovine. I do know that there's huge resistance or decreased efficacy in those areas too. But I don't know if, because the worms aren't the same, I think it just might be us causing the problem.
Ursula, are you seeing kind of the same evidence from your work in the equine centre? Is there anything different that you would add? Or
well, I would have always thought that, when we get in post-mortem, if I see a lot of Strongyles vulgaris, I always associate that with premises that are not doing a huge amount of worming, because they're actually still quite sensitive. If I see a lot of cyatostomiasis, I usually associate that with places that are doing a lot of worming. So some of that cyatostomiasis problem, is actually to do with resistance, your wormer being effective for a shorter period of time. But I also think maybe it does depend on the initial level of infestation. The fecal egg reduction, you just have to bear that in mind.
Yeah,
exactly. It's not straightforward. There are complexities to the story.
Yeah.
Absolutely.
And that's why you often will get a decreased egg reappearance period on farms, like Ursula had said, because you've only killed off 60% or 50% or even sometimes less of the burden. And so now the eggs reappear, and it's not necessarily because the worm didn't work against the stages, it just didn't work against all of them, so it's hard to interpret sometimes.
And this is why it's so important that there are individual worming plans for farms, and why there is individual advice in relation to having the conversation with your vet and working through things and the follow-up, and not just.
And I know it sounds really political like that. I'm not giving you an answer, but unfortunately a lot of the time it can be difficult.
I think that's the importance of this conversation. I will ask you to quickly touch, and we will have to call a halt now very shortly, in relation to, you mentioned already, Nikki, like that there are, obviously unlicensed products being used, and I'll actually come to yourself, Ursula, your take on the unlicensed products that are in use with horses. We had a conversation about this the other day.
Yeah, I did. This is giving it parenterally as opposed to orally, or products that are. Speaking to Professor Baggett years ago, who was our director, and he was a pharmacologist. From a pharmacological point of view, anthelmintics that are given parenterally are more effective. Like there's no doubt about it. People can even see it, because you're not giving it orally, it's not binding to food, you don't have to absorb it, and then you don't, you activate it in the liver. Now, they're not licensed for IV or IM use. They are, like, from a pharmacological point of view, probably more effective. If anything happens, you're not covered, it's tough luck.
There's
there was a question there I saw about mites.
yes,
leg mites.
yeah, good on you.
Yeah, so there's a couple of things there. If it's an older horse, I would definitely look to see if they have Cushing's. So Cushing's causes immunosuppression, so it decreases that immunity and can make them, if they haven't had persistent problems before and now do, you definitely would be thinking along the lines of that. So a very simple test, blood test, you can get done on that. And the other thing is changing the environment. So I'll often clip the legs, and a lot of people hate that, and I appreciate that they want them to keep with feathers, but clipping the legs changes the environment. And just be careful, it can be a bit painful for them, so maybe you might want to sedate them for that. And then the last thing I use is off license. It's only a spray though, it's not some of the injectables you can use, but you know the frontline spray, it's just like a dog flea and something spray. I'll put that on twice a week at the start, and then reduce that to once a week, and then reduce it to every second week, and I've had good results with it. I've used it in about 6 quite serious chronic cases, and got good return. That's not literature for you now, that's just clinical, but they'd be my couple of tips for that one.
Lice, Ursula?
Yeah, that's.
Have you an opinion on managing those? Nikki, even?
Lice treatment.
Lice treatment.
I don't know, Ursula, have you noticed there's a lot more lice around, or is that just my imagination?
Not really, no, to be honest.
Maybe it's the new horses I'm dealing with.
Yeah, not really, no. I would have said in the last few years, like horses coming in for PM, certainly, there's a lot less lice.
Okay.
Obvious, yeah.
Okay.
Again, with lice, it's about, like, if they have a thick coat, clip them out. You know, lice don't lice don't tend to hang out as much, but they still do on like lovely glistening coats. You know, they like the little furry ponies and stuff, so clip the coat and you'll make a big difference. There are some off license pour-ons, but you know, you have to take a chance on those.
Look at ladies, I know it has been like literally the whistle stop tour and putting you under pressure on some of those questions, and I thank you for your patience on that. Before we say goodnight to everybody, would you both like to make kind of your, I suppose, what you feel are the most important take-home messages for people from your experience and from the discussion that we've had this evening? If I come to Nikki first, maybe. Yeah,
sure. I suppose it's just as Ursula pointed out in her presentation, you know, unfortunately there's no one size fits all in Parasite C. You have to remember you're not just dealing with the horse, you're also dealing with the dynamics and the adaptability of a parasite. So depending on how your farm works, how you rotate, what animals you have, even how you feed them, all these things, the climate, everything factors in. You know, different parts of the country have different parasite problems. So unfortunately, it's about trying to figure out what your risk is, working either with a vet or with the information you have, and trying to come up with a plan from that point of view. And remember that fecal egg counts are good when applied the right way.
Ursula, how about you? What's your parting message for people?
So just speaking from my own point of view or from perspective, and I'm totally guilty myself, but I think if you know, to record what you do is terribly important. You know, there are all sorts of fancy computer systems. You know, you can do it on your phone. Maybe sometimes a wall chart that's up in the tack room or somewhere you can see it every day, so you know who you've given what to at what dosage. If you do a fecal egg count, have that there as well, that you can see it. Where have you got the horses? You know, from where have you moved them to? Where have they been? And gradually, I think we'll begin to see a pattern, you know, for your own farm. It might highlight areas, you know, that actually lead to a problem. You know, because it's very easy just to go in and say, oh, we dose them all and we'll do this. And then in 2 months' time, did we or did we not?
And what did we use and how much did we? And
that's right. Yeah. And then from there, you'll be able to see. Yeah.
Just Wendy, there's another few questions and stuff. Like we can always answer these questions offline and give you those.
Absolutely. I was just going to say that we've done our best. The audience interaction has been superb this evening. There's been a flurry of questions coming in. They're much appreciated, and I might liaise with the afterwards in terms of giving responses to the ones that we haven't hit, if that's okay. So I would like to extend my sincere thanks to both of you for your time in joining us this evening. I would like to let our listeners know that I will be back here, same place, same time, the 1st of December, and I will be joined by Ursula's colleague, Dr. Anne Conlon, and Anne is the head of virology there in the Irish Equine Centre, and we will have a discussion around protecting herd health, vaccination, biosecurity, and the other matters that I'm sure Anne will bring to the table in that. So I appreciate all of your time in being with us, and I thank you ladies for now, and I look forward to the rest of you joining us again the next time.
And I'd just like, maybe on behalf of Nikki and myself, to thank you very much, Wendy, for being such an accommodating and agreeable host to work.
Facilitating all our technical glitches as well.
Yeah. Us through all that we need to and have.
It's part and parcel. Part and parcel.
You definitely held her hand along the way anyway, Wendy.
Yes,
thanks.
No problem, ladies. You're very welcome. And I'll talk to you both briefly in a moment. All right. Okay. Thank you very much. Good night, everybody.
Good night.